Hi, my name is Hritika Nandakumar. I'm currently from Georgia, and my mentor for this project is Mike Thorson, and today I will be presenting my research project about molecular mechanisms and of Coxsackie and Epstein-Barr virus induced myocarditis. So, what exactly is myocarditis? So, myocarditis is commonly known as inflammatory cardiomyopathy and is the inflammation of the heart muscle. To be specific, it affects the myocardium, the middle layer of your heart muscle. Cardiomyopathy is the classification of diseases that affect the heart muscle specifically. Acute myocarditis occurs suddenly and lasts for a short amount of time. Chronic myocarditis, on the other hand, is when acute myocarditis does not disappear or symptoms reappear. Symptoms include chest pain, fatigue, swelling, arrhythmias, shortness of breath. Myocarditis is commonly occurs due to a viral infection. Other reasons can include bacterial infections, toxins, autoimmune responses. The treatment depends on several factors, including the severity and the cause. However, since many cases of myocarditis is self-resolved, one of the most common treatments is medications. These medications' aims are to reduce pain and to be anti-inflammatory. Okay, so Epstein-Barr virus, human herpes 6, um, and HCMV, which are members of the herpesvirus family, have been linked to myocarditis. These double-stranded DNA viruses are prevalent among the population. Although uncommon, EBV has been shown to cause myocarditis in patients. An acute case of EBV induced heart inflammation has been previously associated with the pressure of lymphocytic infiltrates and a T cell marker CD54RO. This disease severity, progression, and outcome vary among patients, and in some case, symptoms can resolve on their own, whereas in others, the heart becomes irreversibly damaged, leading to the patient's death. Reactivation of the virus after the initial infection has also been previously reported. Okay, so that's just my introduction of the Epstein-Barr virus. So what is a Coxsackie virus? So the Coxsackie virus is one of the most common causes of cardiac inflammation. This common infection usually includes symptoms such as fever, rash, joint pain, and sometimes gastrointestinal distress. Yet, unresolved CBV infection can impact the heart muscle negatively. Between 25 and 40% of myocarditis or cardiomyopathy cases are contributed to CBVs children and young adults. In children and young adults, CBVs can cause inflammation of the heart in two ways: direct cardiac injury or indirect immune mediated damage, which I'll be talking about later on. CBVs utilize a protein called Coxsackie, an adenovirus receptor, and a co-receptor called DK accelerating factor for entry. Coxsackie viruses often lead to acute myocarditis. Okay. So the Coxsackie virus can directly infect. Okay, so these are like the main two viruses I'll be studying in my case. And I wanted to basically see, like, through my research paper, like, to know how exactly these can lead to myocarditis. I know, like, a lot of cases can be rare, like using these viruses, but there's a lot of cases like linking both of them. So even if it doesn't directly cause it, it can cause to like inflammation of the heart muscle, one way or the other. And these are the um I'll be talking about the three main ways on here, and a few more. So the processes of infection can include direct viral damage, which is when Coxsackievirus can directly infect the heart muscle cells, leading to their destruction. The virus enters the cell and replicates, causing cell damage and triggering an immune response. This damage to the heart muscle can result in inflammation and myocarditis. Okay, so the second one is an immune response. So the immune system plays a crucial role in responding to viral infections. In some cases, the immune response itself can contribute to tissue damage as the immune system works to eliminate the virus. It may inadvertently target and damage healthy heart tissue, leading to inflammation. Autoimmune responses. In some instances, the body's immune system may mistakenly identify certain proteins in the heart muscle as foreign, which can be known as a process of molecular mimicry. This can lead to an autoimmune response where the immune system attacks the heart tissue, causing inflammation and myocarditis. Another process of vasculitis, process of infection is vasculitis, which is in Coxsackievirus can also inflame the blood cell vessels, which may affect the blood supply to the heart muscle. Inefficient blood flow to the heart can result in damage to the heart tissue and contribute to myocarditis. That is my case. Thank you.